Works the way it should. Ah, okay. Well, so I'd like to start by acknowledging the funders. These are the groups that have funded us over the years. We're currently funded right now by Transport Canada, and I'd just like to say that I have no conflict of interest related to this research. So, this research focuses on what I call moderately impaired drivers. These are people who come to a hospital, emergency department after a car crash, and they require blood testing as part of our clinical evaluation. So, this would be usually people who come by ambulance. There's been some vehicle damage, maybe the driver appears to be injured. This is not the fender benders, the minor rear end collisions, say that, get a little bit of a stiff neck a few hours after the crash and come in to get checked out. So I call these moderately injured drivers. And the way what we're doing is what we'll check the emergency department visit log to see who came through the department. Research assistants do that every day or two. We identify all of the injured drivers who came through. We see which one of those had blood work done. And typically, when blood work is done, the hospital lab doesn't use the entire vial. There's a little bit left over. And we go up and take that, and we, with permission, of course, and we relabel it so it's not doesn't give the driver's name anymore, and we freeze it, and then it gets analyzed later. And then the research assistants look at the medical record and they look at things like was it a man or a woman who was a driver? How old were they? Was it a daytime crash or a nighttime crash? Were they admitted to hospital? Do they have any health problems before the crash? What medications do they take? And then the blood gets analyzed, and we're doing that now in Vancouver in a lab that we have set up here. So we do a broad spectrum toxicology test, including for cannabis. So we are currently running the study at 17 hospitals across Canada, including one in Ottawa. These are indicated by the little stars here. So it's a coast to coast study at this point. We started in British Columbia way back in 2009, I see, looking at my records. And around 2018, we started expanding outside of BC. So now we're coast to coast. These are some of our findings. So if you look at the far right, so just that these bars sort of indicate the number of drivers that test positive for different impairing substances. So if you look at the far right, you see that over half of the drivers tested positive for at least one impairing substance. And then if you go left to right, you see that alcohol is probably the most common impairing substance that we're finding. 15.7% of drivers, about one in eight, slightly under one in eight, 12.1% of the drivers that we saw were above the legal limit for alcohol. And then when it comes to cannabis, I'll just orient you here. This THC, COOH, that's what we call carboxy THC. That is an inactive breakdown product of cannabis. So it just indicates that the driver used cannabis at some point. It doesn't have anything to do necessarily with recent use or with impairment. So we see that over a quarter of the drivers test positive for having used cannabis. But the numbers that we're really most interested in are THC above 2 and THC above 5. 5 is where you, I think, start to see increased risk of collisions. And these are the two legal limits in Canada as well. So THC above 5, about 2.8%. So, if you just compare that with alcohol, there's not as many drivers with high THC levels as there are with high alcohol levels. And then there's a bunch of other substances that we're finding, a little over 10% test positive for an opiate. So that would be something like morphine or codeine, a prescription opiate, or a recreational drug of illicit drug as well. CNS stimulants, those are things like cocaine or amphetamines. 13%. And a depressant, those would be prescription medications like a benzodiazepine that people take to help them sleep or to treat anxiety, antidepressants, and so forth. So that's the biggest single category, 27%. But this is a hodgepodge of a whole bunch of different substances. So I guess the take home here is there's a lot of substance use in these drivers that have been in a crash. The next point I wanted to make is that the numbers vary from coast to coast. They're not the same across the country. So these are each panel here represents a different substance. BAC is alcohol. The two categories for cannabis, THC above 2 and above 5, and then the opiates, the stimulants, and the depressants. And, just as a general picture, the numbers seem to be worse in Atlantic Canada, a little bit better in BC and in Ontario. The numbers should be zero, at least for many of these, but there's variability across the country. Okay, so we're talking about what happened after cannabis legalization. And as I said, we've been collecting this data for some time. So we had data that was collected in British Columbia before cannabis was legalized and again afterwards. So October 2018, cannabis was legalized. One of the concerns with legalization was that there was going to be more cannabis impaired drivers on the road, more collisions related to that. And the government made several changes to try to prevent that from happening. They trained more traffic police, frontline traffic police, to recognize drug impairment. They trained more drug recognition experts. They set legal limits for the amount of THC that someone can have in their blood, 2 and 5 nanograms per mil, higher penalties at 5 nanograms per mil, and a combined offense as well. So that's alcohol combined with THC. And they approved some drug screening equipment which can test for THC in saliva. So the hope was that all of these measures would prevent an increase in cannabis impaired driving. Well, let's see how well that worked. So this is from the study in British Columbia going back to 2013. We had 4 hospitals that participated regularly throughout that time. And the vertical line here, the dash line, is the date of cannabis legalization. And the light green and darker green lines are THC, the active ingredient in cannabis, at different levels. So the lightest line is THC above 0, just detectable. The darker green is THC above 2 nanograms per mil, and the dark color is THC above 5 nanograms per mil. And just looking at that, it certainly gives the impression that the numbers went up after legalization. Here we have just the crude numbers before and after legalization. So if you take all the cases and combine them, before legalization, cannabis was detectable in 9.2% of drivers. After, that jumped up to 17.9. Just for reference, alcohol was at 11.5% and went down to 9.8. And the combination of the two, alcohol plus cannabis, that also increased 2.1% to 3%. But those are just all the numbers combined, what we call crude numbers. When you analyze that, you have to consider whether it was a young driver who tends to use cannabis more often or an older driver who may be more likely to be drinking and driving, whether it was a male or a female, which hospital contributed the data, and so forth. You have to consider trends. What was happening before legalization? Was the rate of cannabis use already increasing, and legalization just happened to come along at that particular point? So we get what we call adjusted estimates. And after we statistically accounted for all those things, the numbers here show that THC above 2 approximately doubled, and THC above 5 also approximately doubled. So there was about a doubling in the prevalence of drivers who were above the legal limits for THC after legalization. And I don't show it on this slide, but the biggest change was in older drivers over the age of 50. In that group, the numbers were lower in that group to start with, but they actually increased fivefold after legalization. So a large percentage increase in drivers over the age of 50. Um, for alcohol, after all those adjustments, there was really no change at all. And the combination of alcohol and THC, a trend towards a change, but it wasn't statistically, it could have been due to chance, not statistically significant. So the big take home here is that the prevalence of drivers with THC, with high THC levels, approximately doubled after legalization. So that was data up to March 2020. We didn't report on data during the pandemic in that particular analysis, just because we weren't sure how the pandemic was going to affect things. But what's happened since March 2020, and as you all know, a lot of things are happening in the world since then. But relative to cannabis, these are the numbers that we had. So this is from hospitals in four provinces, BC, Alberta, Saskatchewan, and Ontario, 8 hospitals. And you can see that, and again, the same three categories. So THC detectable, drivers who had used cannabis at some point relatively recently, THC above 2, THC above 5. And there, just looking at it, it does look like the numbers are trending down after this initial increase. This is the same thing where we just average the numbers out over the year. So it's the annual percentages. And again, you can see that the numbers started high right immediately after legalization and then have been trending downwards, maybe leveling off in the last couple of years. Again, we analyze that to see what the numbers were after adjustment. And this 0.83 means that each year, the number of drivers testing positive for cannabis was 83% times what it was the year before, meaning there was a decrease. The decrease was about 17% per year, and that's for drivers with THC above 2 and for drivers with THC above 5. So the summary of everything is, well, first of all, as I showed you, a lot of impairing substances in injured Canadian drivers who come to hospital after a crash. In terms of what happened after legalization, in the first year, we saw this big increase. The percentage of drivers or prevalence of drivers with high THC levels approximately doubled. And since that time, the prevalence decreased by about 17% per year. So that's the talk. I think, Eric, do you want to let Christine give her talk and then we'll have time at the very end for questions or?
Yep.
Yeah,
That's exactly how
okay.
we're going to do it.
Okay, so here's my contact information. If you want to email me, jeff.brubaker, easy to remember. Just remember the CH in Brubaker. So jeff.brubaker@ubc.ca. And if you go to this website, Road Safety and Public Health.med.ubc.ca, we have some reports and publications there if you're interested. I will stop sharing and turn it over to Christine.
Thank you, Jeff.
See if I can get this to work. There we go. Can everybody see my slides? Perfect. Okay, so today I am presenting portions of a commentary paper that I prepared entitled Driving Under the Influence of Cannabis, a Risky Proposition After Legalization. And it was co-authored by Pat DiCiano and Bernard LaFolle, so I'd like to acknowledge them. So within Canada, data to evaluate the impact of legalization on cannabis use and related harms, including driving under the influence of cannabis or DUIC, that comes from multiple sources. And so Jeff has just presented some really interesting data on collision injuries. And that's one way that we can monitor DUIC. But another way that we can look at it is through survey data. And so today I'd like to take a look at how cannabis use and related harms have changed since the legalization, according to what the survey data can tell us. So let's jump right in and let's focus right away on prevalence of cannabis use. And several population representative surveys collected data in 2019, that first year after legalization of non-medical cannabis use. Now, the definitions that were used for cannabis use varied from one survey to the next. Some talked about any past year use, some looked at any use in the past 3 months. But generally speaking, all the surveys I've come across have reported an increase in the prevalence of cannabis use in that first year post legalization. So let's take a look at a few of these. Well, it's not moving forward. There we go. So Steve Brown, I know you're on the call. I'm going to start with the Turf Road Safety Monitor. This comes from the Traffic Injury Research Foundation, and they found that among Canadian drivers, prevalence of cannabis use increased from 12.9% in 2018 to 23.3% in 2019. The CAMH Monitor is a repeated cross-sectional survey of Ontario adults aged 18 years and older. And as you can see here, the Monitor also reported an increase in cannabis use in 2019. And the National Cannabis Survey, it's asked of respondents aged 15 years and older living in Canada's 10 provinces. And again, cannabis use prevalence increased from 14.9% to 16.8% post-legalization. So I've summarized those three results into this very pretty table. They all focus on the first year post-legalization. But what about prevalence of cannabis use in the years since 2019? Well, as Jeff alluded to, this, of course, is complicated by the pandemic, which began in early 2020. And so we were sort of all stuck in our homes and our daily patterns really changed quite drastically. And so the question becomes, how do we tease apart the effects of cannabis legalization from the effects of cannabis? And it's not really a simple question to answer. I don't have an easy answer for you. So we just need to keep this in mind as we interpret some of the data here. Now, when looking at data since 2019, we want to look for studies that can track trends over time. And so the Turf Road Safety Monitor and the National Cannabis Survey are not done on a regular basis. They're done periodically. The CAMH Monitor is done annually, but it switched from telephone interviewing to online web panel survey in 2020. So the methodological shift there in both cases, both for the Road Safety Monitor, the National Cannabis Survey, and for the CAMH Monitor, they're not really great at looking at trends over that period of time. But there are other surveys that we can look at, and I've selected the Canadian Cannabis Survey for demonstration purposes today. So the Canadian Cannabis Survey is an online survey that is conducted annually, and consistent with other surveys, when we look at 2019, there it is. You see that increase in prevalence of cannabis use in that first year post-legalization. And when you look at changes over time, you see that there's a little bit of movement up and a little bit of movement down. But generally, the prevalence of cannabis use remains higher than it was prior to legalization. So I've added that to the table here. And so it's a very lovely table and everything looks perfectly consistent. But of course, we're interested in driving behavior. So if the prevalence of cannabis use has increased post-legalization, what's happened with the prevalence of driving under the influence of cannabis? Many of us ahead of legalization expected that driving under the influence of cannabis would increase, but did it? Well, I don't want to ruin the surprise, but be prepared for a little less consistency as we move forward here. And again, I want to note that as we go through the surveys that have looked at DUIC prevalence, you'll see that the definitions of DUIC vary a little bit from one survey to another. So let's start again with Turf's Road Safety Monitor. This survey did in fact find the expected increase in DUIC in 2019, and there it is. You'll also notice right next to it, of course, there's a sudden decrease in 2020. We don't know, is that perhaps a result of the pandemic? Is it a result of some other trend? It's difficult to tell because because we don't have trend data to follow that. But let's see what the other surveys tell us. Here we have the CAMH monitor, and you'll notice the CAMH monitor didn't see a change in the prevalence of DUIC in the first year post-legalization. And here we have the National Cannabis Survey, and like the CAMH monitor, it too did not see a change post-legalization. On the contrary, however, when we look at the Canadian Cannabis Survey, in fact, we find that the prevalence of DUIC declined following legalization, although we did see a little bit of a bump last year. So I've updated our table here. I've added the DUIC column on the right-hand side. And as you can tell, it's nowhere near as consistent as the cannabis use data. So how do we make sense of this? Can we make sense of this? Well, as I was thinking about this, I was like, well, what variable might explain some of these results? And I'm going to suggest something perhaps unusual, but it's how DUIC was calculated. So in the surveys that we've reviewed today, sometimes researchers calculated DUIC prevalence across the whole sample, and sometimes they calculated DUIC across the subsample of cannabis users only. So the question is, what did they use as their denominator when they calculated the percentage of participants reporting DUIC behavior? And does this matter? Well, it seems that great minds think alike, because Kucera and Hammond published a study shortly after I started looking at this. Isn't that always the way? You get a brilliant idea and then somebody beats you to the punch. But that's okay. I'm going to present this amazing research anyway. So using Canadian data from the International Cannabis Policy Study, they looked at changes in the prevalence of driving under the influence of cannabis, but they calculated prevalence in both ways that we've talked about. So here on this slide, we see analyses where DUIC prevalence was calculated using all of the respondents as the denominator. And so, as you can see, there was no significant difference in DUIC prevalence in those first 3 years post-legalization compared to pre-legalization. And then after that, DUIC prevalence was significantly higher in 2022 and 2023 compared to the pre-legalization level. And yes, that decrease from 2022 to 2023 was statistically significant. But then what happens when they calculated DUIC prevalence using cannabis users only as the denominator? Well, that's on this slide here. So DUIC prevalence decreased significantly from the pre-legalization level in the first year, and it's remained below that pre-legalization level ever since. So you can see when you compare these two graphs that the denominator really does make a difference. So depending on how you calculate DUIC, the pattern of prevalence since legalization is really very different. So here I've added that ICPS study on the bottom line. And with that added, it starts to tilt the scales further in the direction that I had sort of hypothesized, that although prevalence of cannabis use increased post-legalization, so although prevalence of cannabis use increased post-legalization, the prevalence of DUIC, when calculated across the whole sample, saw very little change. But when we calculate it based on cannabis users only, there was actually a decrease in DUIC behavior. So something's going on amongst those cannabis users. So what might explain this possible decrease in DUIC post-legalization in cannabis users? Well, as Jeff also discussed, Canada really adopted a multifaceted approach to address cannabis-impaired driving. So, we introduced per se thresholds. We had the approval of oral fluid drug screening equipment for detection of THC, and we've invested heavily in drug enforcement training for police officers. But as someone who comes from social behavior and health sciences, I'm more inclined to be interested in the role of public health and public safety advocacy in changing risk perceptions of cannabis use and DUIC. So let's see what survey data can tell us about that. So earlier this year, Doggett et al. Published results from a longitudinal survey that collected data from community dwelling adults aged 18 to 65 living in Hamilton, Ontario. Data collection occurred up to 11 times per participant from September 2018, the month before legalization, up to October 2023. And the survey identified several changes in perceived risks associated with cannabis use. And I want to draw your attention to a few of the more interesting ones today. So let's take a look at the graph. Let's start with the light blue line on that graph. And that represents the belief that cannabis use carries no risk. Now, that in and of itself is a high risk perception to have. And we see from the graph that the proportion or the percentage of respondents who held this high risk perception declined from 25% before legalization to 14% in October of 2023. The purple line, which follows a very similar path on the graph, represents the belief that cannabis is not addictive. Again, that's a fairly high risk perception. And so we see that that high risk belief declined from 24% before legalization down to just under 16% in late 2023. But what does the graph tell us about driving related risk perceptions? Because, that's what's important to us today. Well, take a look at the two red lines. The solid red line in the center of the graph is the belief that cannabis-impaired driving is safer than alcohol-impaired driving, and it shows a decline over time. And the dashed red line at the top is the belief that cannabis-impaired driving is equally safe as alcohol-impaired driving. It's a bit kind of counterintuitive to me, so sometimes I think about it as cannabis-impaired driving being equally unsafe as alcohol-impaired driving, if you want to think of it that way. But you can see that that line is increasing, which shows that the proportion of respondents who view these two driver behaviors as posing the same safety risk increased over time, which is a good thing. So across those four perceptions, we're seeing increased recognition that cannabis use poses a threat to health and safety. And interestingly, most of the shift towards perceiving cannabis as a greater safety threat was seen among those who had used cannabis prior to legalization versus those who had not. And this could be because cannabis users have matured between 2018 and 2023, or it could be that they've experienced cannabis-related harms in that time period. But either way, we're seeing evidence of a shift in how we perceive risks associated with cannabis use. So let's go back to the Canadian Cannabis Survey for a moment, because it shows a similar change in cannabis risk perceptions. So the top set of data, that top rainbow at the top of the graph, shows that the belief that cannabis use can be habit forming has become more prevalent since legalization. So the bottom gray line is shorter than the top red line within that rainbow. And so similar to the results from the Hamilton data, it's the respondents who reported using cannabis in the past 12 months who were more likely to acknowledge the habit performing potential of cannabis. And I think it's the fifth set of data down. The survey also demonstrated that Canadians increasingly recognize that smoking cannabis can be harmful, again, showing recognition of the risks associated with cannabis use. The survey also measures perceived risk of regularly consuming various substances. So the yellow line in this graph represents the percentage of respondents who perceive moderate or great risk of smoking cannabis. You can see that line has increased, showing greater recognition of the risks associated with smoking cannabis. The dark blue line represents the percentage who perceive moderate or great risk of regularly vaping cannabis. That line has also increased. Unfortunately, we don't see the same recognition of risk associated with eating or drinking cannabis. So eating and drinking cannabis in Canada has become a much more common method of administration of cannabis. But our perception of risk hasn't really changed that much between 2018 and 2024 as it has for smoking and vaping. The Canadian Cannabis Survey also asks if the use of cannabis impairs one's ability to drive or operate a vehicle. And among all respondents, which you see on the left, the percentage of Canadians agreeing that the ability to drive is impaired has increased from 81 in 2018 up to 86% in 2024. But what's really interesting, I think, is when we look at those individuals who reported using cannabis in the past year, we focus exclusively on them. And that's the graph on the right. And this is where you see that the change in those risk perceptions is much more pronounced amongst those who have used cannabis. So those who respond that yes, cannabis use impairs one's ability to drive increased from 61 to 79%. Those who said, well, it depends, that declined from 22 down to 13%. And those who said, no, it doesn't impact my ability to drive, that dropped from 12 down to 6%. Now, because risk perceptions are associated with behavior, changing risk perceptions really is a key strategy in models of behavior change. And given that we're seeing a simultaneous increase in cannabis risk perceptions and a decrease in DUIC since legalization, despite an increase in the prevalence of cannabis use, it's possible that Canada's early efforts to educate the public on the dangers of cannabis are having a lasting effect. So the Canadian Cannabis Survey also tells us that while we've seen risk perceptions improve, as I've shown you, we've simultaneously seen a reduction in the percentage of Canadians who report viewing educational messages or educational campaigns about cannabis. So in 2019, the year after legalization, 76% of Canadians reported seeing this type of messaging. But by 24, this number had dropped to just 50% of the population. So it may be that our early efforts at the time of legalization to educate the public on the risks and the dangers of cannabis use may have taken hold. So I want to leave you today with a bit of a to-do list, because while the DUIC data that I've presented today are promising, we really have no guarantee that DUIC prevalence will continue to fall. And if the rise in cannabis use is too steep, then the overall number of DUIC events in Canada could still end up increasing over time. So we've been really good at reducing the prevalence of DUIC amongst cannabis users. But there are so many more cannabis users every year that we could lose pace and see an overall rise in the behavior. So we have to continue our efforts to address impaired driving, and that includes our efforts at public health messaging. In doing so, we have to monitor for continued change in health and safety risk perceptions around DUIC. We have to continue exploring which groups have seen the most change in risk perceptions and in DUIC, and we have to continue to explore which approaches to messaging are most effective in soliciting change. And very importantly, and I say this as a scientist who does a lot of evaluation work, our evaluation efforts have to look at more than campaign reach. So today I've been speculating that public health messaging has changed cannabis risk perceptions, but we don't have a lot of data that directly assesses the impact of that public health messaging. So when we develop a public education campaign, we should be looking at how the messaging affects risk perceptions, behavioral intentions, and actual DUIC behavior, rather than just whether or not someone has seen that public health message. And very importantly, when we have that data and we've done that work, we really need to make the effort to publish it or distribute it broadly and widely to the full road safety community. And finally, most of the existing data focuses on health and safety risk perceptions of cannabis, and that's what I've presented today. But there are other risk perceptions that are also very relevant. Things like whether or not you believe you'll be detected by a police officer when you drive by if you're driving impaired by cannabis. Do you think that you'll face legal consequences for driving while impaired by cannabis? So these are important risk perceptions to consider, and future research is certainly needed. So I've provided my references here for anyone who would like to look up any of the very helpful studies that I've presented today. I've got my conflict of interest statement here for anyone who is interested. And with that, I will thank you for your kind attention. And I look forward to conversations with everyone on the call about this topic. So thanks, everyone.
Thank you very much, Christine. Just to remind people, if you have a question, please type it out in the chat and I'll make sure it's read. In the interim, Steve Brown from Turf. Good to see you, Steve. Hope all's well. Just to clarify, Turf's Road Safety Monitor is conducted annually. Okay, I'll give a couple minutes for people to type in their questions, and if not, I've got a few of my own. So now's your chance to ask the experts. I encourage everyone to take a moment, think, and if you've got a question, to type it out in the chat. Okay, I'll just get started with my own then. So when we're talking about people believing that uh, cannabis and alcohol are equally unsafe, are we talking about impaired is impaired or more like the perceived crash risk? Do we know that? Is it a distinction without a difference? Quick-
It's a good question. To be fully transparent, I don't love that question where we sort of relate cannabis impaired driving to alcohol impaired driving. And in fact, Eric, you and I were both at a conference over the summer where that was quite an issue of contention amongst the experts of whether it's a good reflection. We know that alcohol impaired driving. I hope I get this correct because I always confuse the stats. But alcohol impaired driving is involved in more collisions than cannabis impaired driving. And we see alcohol more frequently in fatally injured drivers. But with that said, we don't want drivers to think, well, it's only cannabis, it's okay to drive. So it's not a great question, but it is one that I've seen in multiple surveys for a long period of time. So it's valuable in the sense that it does get at risk perception, and we've got it for trends over long periods of time. So it's good at tracking how risk perceptions have changed over time.
Perfect. Thank you so much. Jeff, could you expand on the next steps for the study? I know you've asked me and a few others at MAD to, help you spread the word. I know we've
Yeah,
got a captive audience, unless they choose to leave. Please don't leave. So now's the time, Jeff, to
yeah.
sorry, I'm very sick, to expand on next steps. Thank you.
Yeah. Well, thanks, Eric. Yeah, I didn't put my little request at the end, but so this is a study, as you've seen, we've been doing for quite a few years now. We have funding to continue it up until the end of this year, after which time the funding runs out. I would like to see this as sort of a continuous, ongoing source of road safety data in Canada. So basically, I'd like to just continue that study. And I think there's a lot of things that could be done with that. I mean, I'd like to see this kind of data included in a national collision database as sort of, providing a little bit of context around drug use in collisions. And I'd like to see it used more for policy decisions and informing policy. But basically, we are looking to continue. And if anybody has any influence with the decision makers, especially probably Transport Canada, who's funding us now, I'd love if people could spread the good word for me. Um, I did prepare a little information sheet. If anyone's interested and wants to email me, I'd be happy to share that with you as well. But yeah, I'd love to see this sort of data collection continued. I think it's really valuable.
Perfect. Thank you, Jeff. You might be able to share it in the chat. I'm not 100% sure. But we have our first couple uh, audience questions. First one is from Christina. Christine, I believe one of your slides showed cannabis users dropped in the category of whether it affected their driving. Could this be because of longtime users, so similar to the term functioning alcoholic, only with cannabis?
So yes, we've done some research in the past. I've been involved in some interview data in particular, where we see that people who are regular cannabis users often don't recognize the impairment within themselves. Um, the idea that, well, it might affect others, but it certainly doesn't impact me. On a more objective level, forgetting the perceptions for a second, but objectively, is tolerance to cannabis a possibility? Yes, I think it's possible. We certainly need more research in that area. With that said, we have seen effects of cannabis acutely, so immediately after cannabis use, even in users who are frequent users. So maybe it's a slightly subdued response compared to people who are using cannabis only occasionally, but you still see effects in people who are frequent users immediately after their substance use. But more research is certainly needed so that we can get a better understanding of how cannabis tolerance may or may not be impacting the effects of cannabis on driving in frequent users.
Thank you. Next question is from Deborah. Thank you for the presentation. Excellent overview. This might be outside the research currently being focused on. However, wondering if motor vehicle manufacturing innovations are being considered for future analyses, re incidence of cannabis impairment and capacity to track drivers who may be impaired.
I don't know about vehicle manufacturers. I can say I've seen a number of different technologies that are being considered by different startups, by different researchers. I've seen breath testing. I've seen galvanic skin response. I've seen the consideration of eye tracking for fleet management in particular. I think what else I've seen. There have been a number of different technologies that are being tested. Eventually, will they be able to detect cannabis? Yes. Eventually, I think they will be. Part of my concern at this stage of the game, and my answer, you'll notice my answers change. If anyone talks to me over a 6-month period, my answers will change from the start of the period to the end because technology is moving so quickly. But recently, we've started to see a trend that the level of THC in the blood is not correlating with impairment. And what does that mean? That's a really tricky question in road safety, especially when we're relying on per se thresholds. So it's something to keep in mind as we move forward. Will these devices be focused on detecting THC? Maybe, or maybe they should be focused on detecting impairment. But all tricky questions for sure. Jeff, did you want to add to that or?
I don't really, this is a little bit outside of what I'm familiar with, so I'm not sure about how that would work for counting impaired driving. I think probably that's a little bit for the future by the sounds of things. Yeah.
I'll just note that the NTSB, the American National Transportation Safety Board, has asked the NHTSA, the National Highway Traffic Safety Administration, who's currently looking at the possibility of mandatory technology implemented in vehicles for alcohol, to also look at it for drugs. Now, drugs obviously substantially more complicated than alcohol. But if you're looking at impairment, there may be some crossover. So even though it won't necessarily be, as effective as passive BAC monitoring, like some technologies options, if there is a monitoring technology in place with a camera, there may be some overlap. So you may see a reduction in drug related fatalities once the technology is implemented on the alcohol side as well. So Jeff Leckie says, it seems to me that a key stat would be understanding of risk among young people. Is it increasing?
I know the data is available. So I think most of the surveys have broken it down into different ages, different, the two primary sexes, male and female, and sometimes by gender, broader groups. So you can find the data. There are also surveys that are focused specifically on adolescents. And so one example would be the Ontario Student Drug Use and Health Survey, or the OSDIS. It's also a survey that's been done for 40 odd years by CAMH. They have seen, and I've got it, I'm trying to see, because I had it originally in the presentation and I took it out because it was getting long. I don't think I had data on risk perceptions from the OSDIS, but we had seen an increase in cannabis use early in 2019 amongst adolescents. That dropped in 2021. So it kind of followed the same pattern. There was a quick spurt and then a back down again in terms of prevalence of cannabis use. And then in terms of DUIC prevalence, it actually declined amongst adolescents in Ontario, and then stabilized after about 2019. But I didn't see any risk perception questions in there, or I didn't review them. I didn't find them. I didn't review them, but we can have a look and see if they're there. But I'm sure you'll find other surveys as well that will look specifically at adolescents. I know that's a hot topic in this area.
Perfect. Thank you.
And
Jeff, did you have anything to add?
Yeah, I can't say about risk perception, but I can say just in terms of the numbers. We looked at different driver age groups and the prevalence of drivers who tested for either alcohol or THC. And in the very youngest drivers, so these would be the novice drivers, the prevalence of alcohol in that group is less than what it is in middle-aged drivers, which, sort of gives you a hint that the messaging around, well, zero tolerance for novice drivers to be drinking at all, and the messaging around you can lose your license and so forth seems to be working on that age group. But when we look at THC, the very youngest drivers who also have zero tolerance for, in most provinces, for driving with after cannabis use, THC in that group, the less than 19, is higher than what it is in middle-aged drivers. So the messaging or probably the risk perceptions are less in the very youngest drivers. They tend to use cannabis more than the older drivers, but the messaging around alcohol seems to be working. So, I don't know what that means in terms of trends over time, but it certainly suggests that there's some skepticism among the youngest drivers about the risks.
Thank you, Jeff. Steve from Turf says, in our fatality data, a lower percentage of drivers aged 16 to 19 were positive for
Mm.
alcohol and drugs than those aged 20 to 34. All right, excellent.
Yeah.
Jeff, could you expand on why it's necessary for all drivers to have samples? I believe in a previous version of this presentation, you had spoken about how some nurses had sort of selected.
Oh, well, yeah. So I guess that you're just getting at our methods. So yeah, I mean, it's important if you try to use if you were to try to use hospital data and just like review the charts and see the data that's routinely collected, you're not going to get the answer that you want. And part of that is that drug testing in hospital is going to be, which is seldom done actually for clinical purposes. But if it is done, it's done based on suspicion. So we wouldn't test somebody for drugs clinically unless we think there's a chance that they are probably going to be positive. And so if you just use numbers that are used based on suspicion, you're going to have, it's hard to know what that means in terms of the general population. So if you're going to study this, you have to test everybody. So you're sampling from the whole group of drivers that are injured. I mean, it's the same as with the coroner's data. Everybody should be tested, not just the people that you think are going to have been drinking or are going to have been using drugs.
Thank you very much. Does anyone have any more questions? We have about 8 minutes left. In the
I,
interim,
I, I have
sorry,
a
go ahead, Jeff.
question or a comment for Christine, actually. Um, and this is about the sort of dichotomy between the increase in cannabis users and the decrease or maybe decrease in DUIC amongst cannabis users. So there's more users, but maybe the people who are using are driving after cannabis less. And I wonder if that's partly to do. This is totally speculative, but people who were following the law before legalization and not using cannabis, and now that it's legal, they're still following the law and they're allowed to use cannabis, but they're following the part of the law about driving after cannabis use. So, in other words, the people who are using cannabis have changed. Does that sort of make sense?
Very much so. I mean, I think before legalization, we looked at cannabis as being sort of a sign of delinquent behavior, right? It was a risk-taking behavior because you were doing something that was considered illegal. Now that it's a completely legal behavior, is it really, a sign of delinquent or risk-taking behavior? I'm not so sure that it is. And so, that you're right on the money there. That could in fact be the case. And so part of the challenge of putting this presentation together was that I'm absolutely speculating. There's not clear connections between everything, and that's where I think we need to do a little bit more research to directly tie each piece to the next. so that we don't have to speculate as to why they're connected.
It's really interesting. Yeah.
Um, Johns asks, is there any data from the approved drug screening equipment charges?
Um, I'm not that I'm aware of. Uh, Jeff, do you know anything on that
I
one?
I think there's challenges with that data. I mean, Eric may know this better than me. I haven't seen it. Um, and this is I'll just make a general statement about using police data. If you start finding that there's more charges related to, let's say, drug impaired driving, how do you interpret that? Because it could mean that there's more drug impaired drivers on the road. It could also mean that police are just doing a better job putting more resources into detecting them, and the numbers go up. So it's a fairly challenging, I think, to interpret police data. But I don't know specific, and I know that there have been efforts to try to compile police data across the country, but that's challenging to do. And I kind of think that this isn't necessarily, I mean, charges there might be, but the number of times that an approved screening device was used and what the results were and how many times it was above versus below, I don't think that's collected. Do you know, Eric? Yeah.
I'm not aware of any
Yeah.
data in that regard, to be honest. Canada's record keeping isn't that great to begin with. So I would, outside of perhaps specific police services, I'm not aware of any data keeping on the ADSEs. It's 12:56. The questions seem to have slowed a little bit, so I'm going to say thank you to Dr. Wickens and Dr. Brubacher for coming today and speaking to us. I know I learned a lot. I know everyone else did as well. We are recording this, so we will eventually send out the recording, as well as the contact information for our two experts today in case anyone has any questions. So I'd like to thank you both. And there's a number of thank yous coming in from the chat, and I'll end it here. Hope everyone has a great day. Take care.
Thank you.
Thanks.